I'm super excited. Today we are going to be doing the first in a series called Doctor Reacts. I know, it's not original. You asked me to do it. I hesitated because everybody else is doing it, but then I thought, you know what? We can do our own ObGyn spin on this. We'll watch shows relevant to women's health, gynecology, labor and delivery, and we'll do an ObGyn React series. So like this video, subscribe if you want to see more like it, and we will be right back with Call The Midwife, Season 2, Episode... Come on now. Fingers not. Let's... Episode 8 of Call The...
Steady.
There. Trixie, show me how to start it. I know you know.
Okay, she looks to be like third trimester, late third trimester, full-term pregnant, and she's getting on a motorbike. I definitely don't think that's a great idea. I certainly would not recommend my patients ride on a scooter or moped or motorbike while they are probably any point in pregnancy, but definitely not in the third trimester. When you're very pregnant, you also have a shift in your center of gravity, so it becomes much more difficult to maintain your balance and to do things that you normally would do with no problem, like ride a bike or a moped or a scooter. So if I was her doctor, I would say, probably shouldn't do that, chummy. Don't get on the motorbike, chummy.
Oh, and this must be Dolly. We've heard such a lot about you. You can come straight through.
Don't give me special treatment just on account of his nibs.
Not at all.
So she looks to be going to a routine prenatal visit. If you were coming to me in the middle of the third trimester for a routine prenatal visit, we would sit down and talk. I would answer any questions that you have, make sure you're feeling okay, find out how things have been since the last time I saw you. We would check your blood pressure and make sure it is normal, and your pulse. And we'll also listen to baby's heart rate, make sure it sounds good, and do a fundal height, which is measuring from the top of the pubic bone to the top of the fundus, which is the top of the uterus. And that roughly in centimeters should be equivalent to the gestational age that you are in weeks. And if that is way off for some reason, then we might do an ultrasound to look into that a little bit more.
My feet are that swollen, I had to come here in my slippers.
May I see? I need you to take a quick tinkle in this.
Well, that's a good teacup.
Chummy is worried about preeclampsia. So she's going to have the patient leave a urine sample so that she can check it for protein. Preeclampsia is a condition where you get high blood pressure in pregnancy, and it's usually associated with losing protein in the urine. And what that does is cause extravasation, or fluid to leave the circulation and go into the body tissues, and this causes significant swelling, most often in the ankles when it first starts, but that can progress to hands and everywhere else. Now, obviously you can't diagnose it just by swelling, because a lot of swelling can be very normal in the third trimester of pregnancy. So that's why she's going to have her pee in this cup and see if there's protein in the urine, and hopefully she's also going to check her blood pressure and check on the baby.
Gary.
I should be back in 2 shakes of a lamb's tail.
So she's checking the urine. That's how they used to do it. Now we would do it with a urinalysis, which is just a urine dip that we stick in this little testing strip and stick it in the urine, and it will tell us the amount of protein in the urine. This is how they used to do it back then.
As Doctor explained, toxemia is a treatable condition, but we do need to get you somewhere where you can rest in peace and quiet, and where Doctor can carry out more tests.
So they've diagnosed her with toxemia. That is the old word for preeclampsia, and it looks like they're going to take her to the hospital so that she can have further evaluation. I think that's a great idea. If you have preeclampsia, that is not something that should be ignored or managed without a full workup, and it can be very, very bad in certain situations. And she says here that it's treatable. Really, there's no treatment for preeclampsia. It is manageable, and the real treatment is delivering the baby. So what we try to do is manage expectantly as long as it's safe for mom and baby, and then at some point, depending on the severity of the symptoms, the blood pressure and other symptoms that mom has, depending on how baby looks and what the gestational age is, at some point it will be less safe for mom to remain pregnant because it's either dangerous to her or baby or both, and more safe to deliver the baby even if it's preterm. So we try to optimize that. We try to wait as long as possible, but in some cases that's not really a safe thing to do.
It's frightfully uncommon to have toxemia with the second babe when all went smoothly with the first.
She's right. Most of the time, if you didn't have preeclampsia in a first pregnancy, you won't develop it in a second pregnancy. If you had preeclampsia in a first pregnancy, you're still at an increased risk of that happening again. So now we often will give women aspirin every day from about 12 weeks on to help decrease the risk of preeclampsia if they are high risk for some reason or if they had it in a previous pregnancy. So that's something that you can talk to your doctor and see if it's right for you if you had preeclampsia in a previous pregnancy. Again, that's not for everybody, but it is something worth chatting with your doctor about.
Yes, you've got half the skills of Pat.
Oh, yes. Well, you just wait till I give myself castor oil and advisory pamphlets.
She talks here about castor oil, and that is something that sometimes back then they would use to help induce labor. I have patients ask me about this all the time, and I always recommend against using castor oil to try to make yourself go into labor. Castor oil is a laxative, and basically what you're going to do is drink it and then get a terribly upset stomach and horrible diarrhea. You will have stomach cramps, and maybe those could be mistaken for contractions. And you know, most people, if they do that, are going to do it around full term. Don't recommend it because you might actually go into labor after you drink the castor oil, and you will not be happy about the fact that you have awful diarrhea during your labor process. It is not enjoyable. Don't do it. There is no reason that you should drink castor oil and try to induce your labor because 1, it will not work, and 2, it will make you feel terrible. Just skip that one. I know what the websites say. Don't drink it. Don't do the castor oil thing. Just don't do it.
Well, looks as though things might be on the move, but he's in a good position for delivery.
So he says things are on the move. It sounds like he's just checked her cervix and that maybe she's dilated. And he also says baby's in the correct position. We can tell if a baby is in the right position for delivery, meaning baby is vertex or head down, during a cervical exam if your cervix is dilated enough that we can feel the head. And we do that by feeling on the top of the baby's head for what we call sutures, which are the places where the cranial bone can start to overlap during delivery, so it just feels like certain ridges. And you want to feel really carefully because a baby's bottom, if they're breech, can feel remarkably similar to a head if you're not really feeling for those sutures, because babies' bums are kind of bony sometimes, and you sometimes can feel the outline of the pelvis or the iliac or things like that. The iliac crests of the pelvis, different parts of the baby, which could fool you into thinking it was a head. So it's really important if you're checking a cervix to see if the baby is in the right position for labor to feel for the sutures on that head and make sure that you're not misdiagnosing a baby as being vertex when it's actually breech.
Dolly, I think the best thing would be if I break your waters for you. It'll speed things up a little.
Never better. Just getting swept along in the excitement of it all.
So she offered to break her water, which will usually help augment labor. So meaning you can break the water and sometimes labor will progress a little bit faster. And then also looks like Chummy might be going into labor, which I just think this is like classic labor and delivery nurse, OBGYN, midwife fashion, where you work and work and work until you're ready to have your baby like that day, because most of us just keep working until it's baby time. I don't know. It's the culture. It's what we want to do. Earlier in the episode, she said something to the effect of course I'm going to keep working. You guys are super busy and you need help. Why would I just sit on my bum while you're working hard? And that is kind of the culture, for better or for worse, in labor and delivery units.
Sit now, Dolly.
Squealing like a piglet, just the way we like them.
I just want to say they do a really good job in this show of making the birth look actually pretty realistic. So, I mean, the actresses are doing awesome, both with being the midwife, actress, and the pushing mom, and that baby is definitely in the newborn period. Obviously, it's probably not actually having just been born, but they have a really great fake umbilical cord. The process of delivering that baby, cutting the cord and giving it to mom was very realistic, even for me, and I see it in real life on a daily basis. So, bravo, BBC.
We can't give Chummy an enema. She's our friend.
You don't do it, I will.
They're talking about doing an enema, which is something that used to be commonplace when somebody was going into labor, was to do an enema to clean out the bowels. So they're mixing up soapy water for a soap water enema. We don't really do that anymore. I don't think there's anywhere that does that routinely anymore. But it also marks kind of an interesting thing that happens when you work in this field and you have a baby, is that your friends are taking care of you, and it can present its own set of unique, really great things and unique, very complicated, like emotionally mixed, confusing things about taking care of people that you are close with. It can be really difficult.
Oh, waters. I felt my waters.
Sister Gillian.
Okay, so Chummy just said her water broke, and then when they moved the sheets back, it was a bunch of blood. This is very concerning that she may have actually had what we call a placental abruption, which is where the placenta starts to detach from the inside of the uterus during or before labor. And this can be really, really, really bad because the baby doesn't get blood flow anymore once the placenta is detached. It doesn't always happen all at once. Sometimes it can be part of the placenta, sometimes it can be the whole thing, but it's always, always an emergency. And they're in her house, or I think in the nonatus house, which is the midwifery house where the nuns live and where the nurses live. And so this is a bad place to be. Sometimes when you have a placental abruption, you labor very quickly and the baby is born very fast, and that would be okay. But if she's not really close to having this baby, she needs a C-section right now.
I need an ambulance, please.
Can I have the address, please?
Nonata's house, Leyland Street, Poplar.
Can you give me any more details?
It's a suspected placental abruption. The mother is hemorrhaged.
Has the baby been born?
No, she's still in labour.
And baby's heartbeat?
As far as we know, the baby's still alive.
You heard her say, as far as we know, the baby's still alive. So this can happen quickly, and it can unfortunately have a bad outcome very fast. I hope they can get her to a hospital really soon.
We need her on her left side to increase the blood supply to the baby.
Oh, Chummy, that's it. That's it.
Oxygen.
It's all right. It's all right.
And she needs pethidine. Here.
Breathe deeply. This will help you and the baby.
So she is getting oxygen, which is helpful for the baby. She's on her left side. Being on the left side decreases pressure on the major vasculature of the body. The uterus can compress the aorta and the IVC. So they've rolled her to her left side to optimize blood flow to her and baby. And then she's starting to look like she's a little bit not with it, meaning she's probably lost a lot of blood and her blood pressure is low. Placental abruptions can be lethal for mom and for baby if something isn't taken care of really fast. So it sounds like an ambulance is coming. This is very scary, and one of the reasons that I am not in favor of having babies at home. Obviously this was a different time period and that was very commonplace, but this is a very real life scenario that we all have seen, and it's really scary. And they're doing a really good job portraying it accurately.
She's still in theatre. There was another hemorrhage.
So she's still in theater. That means she's in the operating room. It sounds like they went in to do an emergency C-section and she had another hemorrhage. So they took her back to get started doing the emergency C-section and she started bleeding again. They don't really say if that was before or after baby was out. So at this point, you know, baby could be out and mom could be hemorrhaging, so baby could be fine and mom's life could be in danger. Baby could still be in and they could both be hemorrhaging. I don't know, but that would be very scary as a family member waiting on updates like that. She better not die, because I don't want to cry in this Doctor Reacts video. This is supposed to be us learning about OBGYN things, not me crying about a TV show. Okay, from this very first scene you can tell mom is alive, she's laying there, and she's getting a blood transfusion, and baby is alive, and dad is holding baby. They both look really pale, meaning they probably both lost a lot of blood, and we still don't know if mom is actually okay or if baby's actually okay. Losing that much blood during an abruption, even if mom and baby survive, can still have long-term consequences, like mental issues for mom. Sometimes moms can go into comas and not wake up. That's extraordinarily rare these days, obviously, but it's not impossible. Babies can have major problems if you lose enough blood for mom or baby. Your organs can stop working well because they don't have enough blood flow. All kinds of things can happen from losing too much blood, and death, of course, is one of those, but also just long-term implications to mom and baby as far as mental status and things like that can happen as well. I'm really hoping they're gonna pan over and show everybody is okay and this is a good outcome. I know this feeling personally. I had a placental abruption with Milo and an emergency C-section, and that was one of the most incredibly scary and pivotal moments of my life. Like, I wanted to be happy because he was alive, and I wasn't sure for a few minutes there if he would be alive when they handed him to me. And then at the same time knowing like they can still have major complications related to that. Like, this isn't supposed to be about me, but it's bringing back a little bit of emotion here.
A boy. Hello, little bean. Okay, so it looks like at least Chummy's okay. Hopefully baby is too. Certainly everybody looks to be okay. This is a very emotional episode, guys. I don't know if I can keep doing this.
Through the telescope of memory, I see now the convent was our pole star, a guiding light.
Everybody's okay. Chummy's okay. Baby's okay. The other lady that was pregnant with preeclampsia seems to have recovered, and her baby seems to be okay. Thank you, Call the Midwife, for the good outcome today. Okay guys, that was super fun. I hope that you learned something. That was a great episode. We learned about preeclampsia, high blood pressure paired with losing protein in the urine, which occurs in pregnancy sometime after 20 weeks and can range from just mild to extremely severe, and also worsen to have complications like seizures and HELP syndrome. We also learned about placental abruption and how quickly a seemingly normal delivery can become a very real emergency. We had a really good look into how that is managed, what people go through as a family and as the patient. And I think this was a great episode to start with. So if you guys enjoyed this, please give it a thumbs up. If you liked it and learned something and you want to see more of this in the future, let me know below what episodes or what shows you would like me to do a review on. I want to do some that are more related to OB and GYN things, not just redo all the same ones that people have already done on YouTube. So leave that in the comments below. Like, subscribe. Thank you so much for joining us and supporting us. And if you have a question about any of the things that we talked about today, please let me know. I'll see you guys next time.
Survive.